Good afternoon. It's 2 o'clock in the East, and welcome to Part 3 of the ECHO Group's Billing 201 for Behavioral Healthcare webinar series. My name is Chris Williams. I'm the Marketing Director here with the ECHO Group, and thanks for joining us today. Today's topic, the third part in our 4-part series, is Every Penny Counts, how to review and improve your agency's billing workflow and processes. Following is the information we'll cover in the next 28 minutes or so. A reminder that today's session will be recorded and the slides will be posted and shared with you folks tomorrow, so that you'll have access to this information and be able to view it and review it at your convenience. Just a little bit about the ECHO Group. ECHO has been in business since 1981. We're privately owned, and the same ownership group is in place now as that founded the organization some 37 years ago. Currently, we have partners in over 35 states, and we now offer a unique program for behavioral health organizations that are looking to access or secure a new electronic health record with little or no capital up front. It's our EHR RCO partner program. If you have questions about that program, you can reach out to us, and we'd be glad to share more information about that. For those of you attending who are current ECHO partners, a reminder that our 15th annual peer-to-peer summit is this October in Portsmouth, New Hampshire. It's a great opportunity to come together and exchange ideas, insights, and information. For those of you who aren't current ECHO partners, this is one of the reasons you may want to consider joining us. It's a one-of-a-kind annual event where folks get together and exchange ideas, and it's more than just a user group. It's really a informational exchange unlike any other sort of annual gathering that technology companies typically have. For those of you who attended our Billing 101 series, the 4-part series that preceded our current series, or didn't attend it, that information is available online right now and viewable on demand. The information, the link to access that information is at the bottom of this slide, and you can access it when you get copies of the slides tomorrow. And without further ado, I'd like to turn things over to today's presenter, Callie Zumphy, who is one of our account managers and a expert, one of our many experts when it comes to billing and billing processes for behavioral health care. So, Callie, take it away.
Thank you, Chris. I appreciate that introduction, and I'd like to thank the folks on the phone that are attending today. Today we're talking about making every penny count and finding lost money through workflows. So I have come up with quite a few workflows that you could follow or implement into your agency that can help collect all money and revenue possible. And I have broken it down into 3 different areas, since it's really a team effort. It's not actually just on the billing side. There's areas in the contract department that can help, areas in clinical that can help, and as well as billing. And I really just picked different workflows that I felt tend to be overlooked or maybe even neglected, but yet they're just really super important to be aware of. So many of these you may already know and already have implemented, but I'm hoping that I can leave you with a few that maybe will help you out today. So we'll start first with contracts, payer contracts, and fee schedules. So it's really important to keep copies of your payer fee schedules on file and make sure they're updated. The reason for this is to make sure that you're billing out the correct amount. So a best practice to follow is to bill the full amount of the contracted service or higher. And the reason for that is because if you are billing out an amount that's less than the amount that is contracted in your fee schedule, they're only going to pay you for that amount. And these services, the rates can fluctuate often, so you could be surprised how quickly that could happen. And if you don't catch it, you could be not being paid as much as that you could possibly get reimbursed for. So just maintaining those fee schedules and having them on hand and being aware of them is really important. And then having a staff that is dedicated to the implementation portion of your EHR. So having someone that is aware of any new services that you're practicing, or maintaining the rate schedule for the existing services. So having someone that is dedicated to that is really important. Shouldn't just be left on maybe your billers. Having someone that understands the contracts and the legal aspect, and making sure it's set up into your system is important. And to take it a step further, this person may actually be the one that reviews the payments that are received. Your payment posters might not fully understand or know what your fee schedules are, so it's better to have a second set of eyes to take a look at the payments that are coming in and making sure that they're matching the rates that are on your fee schedule. Then we have add-on services. So researching what services a payer will reimburse you for is important, because you may find that there's certain services that you are already providing that you may not be being reimbursed for. And for example, I have one of the accounts that I manage, a customer gets reimbursed for a therapy session anytime they are seeing a patient that has a language barrier. They'll use some maybe props or tools to help get over that language barrier, and because of that, they can bill for this add-on code. So this was a service that they were already providing, but they just now get to be reimbursed for it because they were aware that the payer did pay for it, and they're now billing it out as an add-on service. So the dollars aren't much behind these add-on services, but when they all add up, it could account for a significant amount. Also, it's important to know that there's communication between the staff member that is in charge of reviewing and researching the contracts and the services that a payer will pay for, because they may not even realize that the clinical staff that provides certain services. So having a full understanding of what services your facility provides and just the workflows of the clinical staff is really key and important to maximizing these contracts and getting paid for everything that you possibly can be. And like I said before, these could be services that you're already providing and just not being paid on. So just pay attention to those. Then we have modifiers. So similar to add-on services, it's good to know what modifiers that you can be reimbursed for. Sometimes modifiers are required, but sometimes they aren't, and they could be a modifier that could get you extra money for a particular service. So for example, I know modifiers are used often when staff has a certain credential. So understanding and knowing which time to use those modifiers is important, because you could be being paid a little bit more money, and it does add up over time. So, and to take that a step further, if when you are aware that a certain credential will be paid for, be paid more for, it's a good idea to have someone, a department head or a manager, kind of manage and utilize the staff with these certain credentials to provide these certain services. That way you're using the same staff providing the same services, just being paid the most amount that you possibly can. So somebody keeping an eye on the schedule and strategically placing certain staff members for certain services is important. So bundle services, there's a couple ways that bundling services can work. You can either bundle services that are the same service. For example, maybe a day treatment. You might have day treatment for a day, and that would mean a patient has multiple group therapy sessions. Well, typically a group therapy session would be paid for only once during the day, and the second wouldn't be paid for, but through the use of bundling, you can get paid for each session that was done during the day. And then the next scenario could be you're bundling different services. And it's possible that when these two services are bundled together, you're being paid more than if you were to bill them separately. So just making sure that you know which services can be bundled and what rates you will receive when you do bundle them. Now, bundling can be tricky, so I definitely make sure that your contract person is fully aware of the guidelines and the rules, the billing rules behind it, to make sure that you are providing these services properly, and then reporting on them properly is really important in setting them up in your EHR. So that brings us to the clinical side. So what areas the clinical staff can do to help improve your revenue and getting every penny possible. So required documentation is the first one I chose, and it's probably a more obvious one, but it's just so important I wanted to mention it. So, you know, finishing the progress notes, the treatment plans, objectives and goals as soon as possible is pretty important. And I know for the clinical staff, they're super duper busy, and often we tend to put aside tasks that we don't love to do. We kind of save them for the last thing we do. But in this case, I like to compare it to a store that sells that has inventory that they're selling. As a store, you don't want that inventory to just sit on the shelf. You don't want to order too much more than what you're going to sell at a time, and that's the way I see it when we let services just kind of sit on the shelf because we haven't finished our proper documentation for it. The agency has already invested in the staff to do and provide these services, so getting paid as quickly as possible is very important. You don't want to financially strap the company by holding on to those. So that's why it's so important to get those done as soon as possible, even though it's something we don't love to do. So a way to help that is using an alert or a tasking system to help the clinical staff know when something is missed and that they need to complete it before service can be billed, and then having a second set of eyes on that is always good. So a department head or a manager is good to keep an eye on that as well, to help the clinical staff out. Send services to billing. So kind of similar to, you know, making sure you finish the required documentation. I know for ECHO there is an extra step that you got to take to make sure that once you have everything in place, the progress notes, treatment plan, signatures, then it needs to be in what we call tagged for processing. So in order for a service to be to go over to the billing side, it needs to be somehow set to say that it's ready. So having someone manage that is pretty important. You don't want to just depend on the clinical staff to say, hey, the service is ready, let's get it over. Having a dedicated staff member to really look at those services and run through an error check to make sure that they are ready, making sure that they're getting processed on time and heading over to the billing side. Using a report to show anything that is still outstanding, or in our words, untagged, is really important too. The ECHO has a report that we use, and you can run it by staff to see what is still there for services that have been performed but haven't been sent over to be billed yet. So this is a great report for a department head or a manager to use to make sure that these aren't bottlenecking and getting caught up for any reason. So that's just another way to kind of help these services get over to billing as soon as possible. Authorizations. So this is a biggie. I know it's maybe a problem area for a lot of people, and it's easier said than done. But I just figured I'd bring up a few ways that I see where authorizations could be improved, and that's by knowing if an authorization is required before even performing the service. Often it's the same services for the same payer that you need authorization for. So just knowing what those are and making sure the clinical staff is aware of those, since they're the staff that usually have to obtain the authorization. And then as well as tracking the authorizations used, you don't want to wait to get a denial on a service before you realize you were out of authorization. So having an EHR that will track your authorizations on the clinical side is really important and helpful, since by the time you get a denial, it might be too late to even be able to obtain that authorization in the first place. So it may be beneficial to actually dedicate a staff member to authorizations and tracking it on the clinical side before it goes over. Our clinicians are very busy people, and often authorizations are overwhelming to keep up with on their own. So if you find your facility has a lot of services that are required, that do require an authorization, it might be financially beneficial to have someone checking these and making sure that they don't enter the billing side before they are billed out if they do need an authorization. Bundled and add-on services. So again, like I said before, these can be tricky. You want to make sure that the services that are to be bundled or the add-on services are going with the primary service provided. You want to make sure that when they head to the billing side that they're going there together. You don't want the billing team to scoop up half of the bundled services and bill them out before the others have even made it over. So it's important to make sure that you're tagging or processing these at the same time, that way that they're not being billed out separately. So if the clinical staff has a good awareness of that, that really helps out that side. And often I have found that sometimes an agency might wait for the end of the week before processing any services because of bundling or add-on services. And you don't want to wait on or you don't want to not process certain services just because you have bundled services. Just be aware that you can send over the other regular services and hold those bundled services to the end of the week if that's how you want to do it. So just making sure those are separate and that you're just being as efficient as possible. And lastly, for the clinical side, patient payments. So patient payments they're not the breadwinner probably for most of you, but it is very difficult to collect on these. The easiest time to collect on these is to collect the money when the patient comes in at the time of service. So for the front desk to know what co-pays are due is very helpful, since they can ask for that money up front right when they come to their appointment. And on the same line, it's important to check to see if there's any unpaid balances, since deductibles are very hard to track with different family members or going to different providers. You may find that they owe more than the copay. And so if there were any unpaid balances, just making sure that the front desk is aware of it and asking the patient for that at the time of service. All right, so that brings us to billing. Error checking. So you don't want to just send process services straight to bills. You want to do some sort of error check first. You'd be really surprised in what you find, even if the clinical side has done their best to check for errors. There's always something that you're going to catch. So whether it be an incorrect diagnosis, or maybe a certain provider did the service that wasn't billable to that payer and needs a supervisor, making sure the rate durations are correct and authorizations are in place. So at this point, it's really good to check for any of these errors that need to be sent back to clinical to fix. And when doing so, it really helps to have a designated staff member on the clinical side to kind of act as a liaison for the billing staff to communicate this to the clinical team, because depending on how large your facility is, it could be complete chaos trying to get your billing staff to get in touch with each clinical staff member that needs to correct something. So having one contact over on the clinical side to help manage these errors is crucial. So then we have unbilled services. So it's a good idea just to keep an eye on any services that have gone unbilled through the use of a report or a dashboard. The reason for this is because maybe your biller isn't necessarily the person that sets up new services or new payers, and services can get caught if it wasn't implemented properly. So having a good idea of what is still sitting in the bucket to be billed is really important to watch for. You'd be surprised how many things could get stuck there and go unnoticed unless you use some sort of a tool to get you those numbers. Also, it's important to pick a particular way that you bill. Just I wouldn't pick a day off the top of your head, out of convenience to you, like every Friday you bill. You want to be a little bit more strategic on that. So be aware of when your payers are processing payments, because it could be that they only process them on a particular day every 2 weeks. So it might be inefficient for your billers to bill every other day if these claims don't actually get processed until 2 weeks. So just having a good schedule and knowing when these payers are going to process and meeting that deadline You don't want to be a day late and then have to wait for the next deadline, because getting these services to the payer as soon as possible, especially with timely filing limits, is really important. So rejections versus denials, I've kind of seen that this term used both ways. To me, a rejection is something, a service that has been submitted to a payer, but for whatever reason got rejected before it actually reached the adjudication level. When this happens, there's a few ways you can track this. You can track it by 999. This report will tell you if an entire billing batch was rejected, and you want to pay attention to this, because if you're doing your AR a few weeks later, you're going to find that all these claims are still on your AR, and if you call the payer to find out why, they're just going to say, sorry, we don't have a claim on file, and you just won't understand what happened. Same thing with the 277. 277 means the billing batch was accepted, but which services actually got accepted within that file. So it's possible that the billing batch got accepted, but only maybe 5 of the claims went through and 30 of them rejected. So knowing and understanding how to read those reports is important to getting your money as soon as possible. And then you don't want to leave out paper billing, since some people, we still have to send paper bills for some payers. So if you have a repeat offender for some certain payers, not having claims on file that you know you mailed, you might want to think about sending those certified just so that you have proof that you sent those out. All right, so patient attention needed. So sometimes for whatever reason, for a certain denial that comes through, it's because attention is needed by the patient, and maybe you've called and tried to get a hold of them. The best thing to do is not to waste your time too much on trying to call them. Actually, just make a patient statement, stick it in the mail, and once they see that they owe money, that should really trigger them to contact you and help you fix whatever went wrong. Or another thing to do is just check the schedule for the next time they're going to be in the office and communicate to the front desk that something needs to be looked at. And lastly, for the billing side is the accounts receivable. So you want to run reports and look at each payer to see how much is outstanding for certain buckets, maybe 0 to 30, 30 to 60, 60 to 90. Of course, the executive team looks at these reports, but it's good for your billers to look at these too. And back in the day when I billed, I like to compare these reports month to month, and I could see, oh, the AR in this certain bucket went up 10,000, and it would kind of trigger me to look into that to see if something went wrong. And also just working, this is a no-brainer, but just working the AR strategically and in a timely manner. So if you have a certain payer that has a very short timely filing limit, maybe you'll tend to work the AR for that payer quicker than the others. So just being conscious of those and strategically working your AR to make sure that you're not losing any money out there. And that's it. That's it for me today. Thank you for listening, and I will accept any questions that you may have at this point.
Callie, thank you very much. For those of you, we are coming up to the bottom of the hour, and we are scheduled to end at the 30-minute mark. But we do have a couple of questions that came in, so if you'd like to hang on, you are more than welcome to join us. We'll go a couple minutes past the 2:30 mark to answer some questions. And also remember, if you do have to drop off, The recording and the slides will be available to you. We'll send you the information tomorrow where you can access them. A reminder, if you do have a question and like to submit it, at the bottom of the GoToWebinar dashboard there, you can type your question in that section there and submit it. And as time permits, we will get to as many as we can. Callie, the first question that came in, the devil is in the details, it seems to me, throughout this whole process. As you're looking strategically at an organization's billing process, do you recommend an assignment-based strategy for your billing staff or a program-based? And by that, I mean, do you have people who are specifically dedicated to a certain task, credentialing, or authorizations for the entire organization, or people are responsible for certain, say, groups of clinicians, and they follow the claim submission from beginning to end?
Great question, and of course the answer can vary depending on your agency, but what I have found is for roles like credentialing and authorization, it's very important to keep the same person doing those roles, since it's not just a role that anybody can just jump into. You want that person to be an expert on the credentialing or the authorizations. However, when it comes to billing, posting payments, working rejections, working the AR, it's good to have the same person working the same payer all the way through. So I don't recommend having someone separately doing the billing, someone separately doing the payment posting, and someone separately working the AR. It really tends to work best and most efficiently with someone that fully understands, for example, the rules of Medicaid. That way, when denials come in, they can just follow the full process of rebilling them and correcting them, in the most efficient way possible.
Okay, Callie, another question that has come in throughout the entire process. You referenced the importance of the clinicians and the role that they play in the billing process with regard to documentation and those tasks that they're responsible for. What is a best practice with regard to overseeing the clinicians from a billing side of the organization to ensure that they're dotting their I's and crossing their T's with everything that they have to do?
Right. So it is really important to have a program manager or a department head that helps the clinicians cross the T's and dot the I's, because our clinicians perform a very important service. They are what we're all about. The paperwork is not their first priority. So having someone there to help them is really important. You don't want a bunch of people coming to them for certain things. It's nice to have one person that maybe is dedicated and oversees everything. And through the use of reports and dashboards that can be utilized within an EHR, that's probably the best way to help them manage what needs to get done. It's probably best coming from like a department head instead of the executive staff, but someone that works closely with them, understands the services that they're providing and their workload and their work schedule. So.
Great. And Callie, one last question before we wrap things up. Again, strategically within an organization, is there a tool or a technique that you can recommend that captures all of this information in a central location, so anyone can take a look at the information and see where a service is anywhere in the billing process with regard to being provided by the clinician, and then through that process all the way through to claim submission and ultimately payment and where it's at through there?
Sure. So the only way to do that is by using an electronic health record for sure. That's really the only way that you're ever going to be able to track that. And through the use of dashboards, it really is the best way to follow a claim right through the end. So you're going to have your clinical dashboards showing how many services you're providing for a certain program. And then you can follow that over to some fiscal dashboards that help tell you what your days in AR are looking like, how much you're billing versus receiving, how many claims have gone unbilled. So reports are always a great way to use this, but a really easy way to just track it for anyone that needs to track it would be through the use of a dashboard, in my opinion.
Is it also helpful, or do you recommend building in redundancies in the system?
Yep. I mean, absolutely. You know, you really need to make sure that everything is being looked at with a second set of eyes. You don't want it just to end with one person. So making sure that there's a few roles in there that are looking at these numbers is really important to making sure everything's working correctly.
Callie Zumpy, thank you very much. It was a great and informative session. Thank you, too, for joining us this afternoon for part 3 of our 4-part Billing 201 webinar series. Be sure to join us again next week as we wrap the series up on the July 27th as we take a deep dive into the appeal process, the nuts and bolts of appealing a denied claim, and then also assessing whether or not it's worth the effort to even make the appeal. So join us next Thursday, July 27th at 2 p.m. Eastern Time. Until then, thanks and have a great week.